Trauma, psychological trauma. So today we're going to talk about psychological trauma. What is psychological trauma? Um, Psychological trauma it's a deeply distressing or disturbing experience that can have a lasting negative effect on a person's mental and behavioral health. And it can be caused by a range of events, including natural disasters, accidents, violence, war, sexual assault. But what is happening lately, there's plenty of emotional psychological trauma going on around, and they're not addressed properly. Some of the symptoms of psychological trauma would include reliving the traumatic event in flashbacks or nightmare, avoiding the reminders of the event, scent, places, music, colors, people, avoiding all that. Um, Another symptom would be arousal symptoms such as difficulty sleeping, irritability, hypervigilance. Which hypervigilance it's a normal reaction to an abnormal event. Um, Other symptoms include depression and anxiety, trouble concentrating and making decision, feeling numb or detached from others, um, and so on. So, in the cases of a psychological trauma, whether the psychological trauma is recent or not recent, it is highly advisable to talk to a therapist and a counselor. Um, Someone that has had training in dealing with after effects of the psychological trauma. Hypnosis will always help, and it helps at a non-cognitive, well, to somewhat to cognitive level, but it goes into a deeper layer of the subconscious to help remove the seeds that are still lingering there into the memory center of the brain. Um, but we'll have Randy talk about more about what's required in the training aspect of therapists that are trained to tend to trauma patients or clients. Randy?
I think my microphone's working, right?
Yes, very
Thought I
good.
was off. Thought I was off. Thought I was off.
Mhm.
You're asking what is the trauma training for therapists?
Yeah,
What do they understand
yeah,
about
yeah.
it? I'm not sure that a lot of therapists trauma is now a industry. I mean, it's a major school of therapy, and so there are more therapists trained in it than not. They're called trauma informed therapists, psychotherapists. But one of the trends that's happening. Well, I guess I'll mention this in a minute. But trauma goes back a long way, but it really became hot when post traumatic stress disorder was first put in the DSM. And when something goes into the DSM, the Statistical Manual for Psychiatry, uh, that legitimizes it. That makes it real, whether it is or not. And of course, it was real, but the extent of it, the how much, what trauma was, how it affected people, has blossomed since then. That was back in the 70s. It's just exploded since then. And now I mean, trauma is the number one school of training these days. So most therapists have some working knowledge of it. Does somebody need to go to a therapist trained in trauma treatment? It depends. I mean, for instance, there's traditional talk therapy. Trauma is usually treated with cognitive behavioral therapy. Well, that's been around for since the '60s, I believe, and it's been around forever. And that's the standard method of it. But there are many other ways to treat it that I don't know. Some are marginal, but what uh, it depends. That's a talk therapy type of therapy. There are other types of which is very legitimate and has worked for many years for many people for a lot of trauma. And I'm talking about just general trauma, not but because trauma is a continuum. It's one thing to PTSD came from the Vietnam War, and it used to be called shell shock. Well, so many veterans came back from Vietnam so traumatized that that's when they developed the official diagnosis. Shell shock became post traumatic. And one of the hallmarks, one of the diagnostic criteria back then was to have been traumatized. A person would have had to have been close to death, either seen death or almost been killed. That was one of the major factors. Was gone away from that for a big time because a lot of people are traumatized by child abuse. God knows how many kids, especially little boys. And I hate to say this, but sometimes I think boys are neglected by society. But thousands of little boys in the Boy Scouts, tens of thousands in the Catholic Church. Uh, those are horrible traumas. And women have gone through that also. Many women have had it too. Uh, but the more recent developments in the last 20, 25 years, I'm not a trauma historian, but well know as I do, Carmen, uh, other treatments that involved no talk at all, or minimal talk, minimal insight. I'm thinking of EMDR,
Hmm.
eye movement desensitization, and uh, oh, I always want to say reprogramming. It's not reprogramming, is it? Eye
Okay.
movement desensitization and reprocessing.
Yeah.
I always want to say reprocessing. Well, that is very closely related to hypnosis, and that became popular. There are now other types of treatment involving eye movement. One of the big hallmarks of trauma in the last 10, 15 years that I've seen is what's called bottom up treatment. Cognitive therapy deals with cognitive thinking. That's top, and it supposedly goes to you change your thinking and you change the way you feel and the way you're emotionally and physically feel.
Hmm.
Bottom up therapy starts with how you feel physically and goes to the top. The training that I've had more recently with hypnosis is that bottom up. And you hear a lot of therapists say, where's that trauma in your body? Where do you feel it in your body?
Yeah.
Where's
Yeah.
it located? And in the first session, we can talk about I was traumatized. I was abused by a parent, sexually abused by a parent, and I still have nightmares of it. And that kind of therapist is going to say, where do you feel it in your body? And you talk about it, where's it in your body? And you start there. That's radically different than cognitive behavioral therapy. Radically.
Of course. Of course, yeah, because hypnosis, that's our aim with hypnosis, to go straight to the bottom of the feeling. Go ahead.
And I just want to put a plug in. Hypnosis has been dealing with trauma longer than almost anything. Hypnosis has dealt with trauma long before cognitive behavioral therapy came along. And hypnosis goes back 100 years or more. And it was I think, one of the first modalities to deal directly with the trauma that a person feels in their mind and their body. And a lot of therapies these days are based in are hypnosis based. EMDR is one of them. And the other thing I want to say, which we may want to talk about, may not, this the new trend now, and I don't know. Not a doctor. I'm not a nurse. I failed pre med. My first couple of hours, I failed pathology. Uh, one of the new treatments are psychedelics, and there are now big workshops on psychedelics treatment. Not MDMA,
Hmm.
LSD. Uh, what's that? Ketamine.
Yes, but
And
not in a recreational way. So we want to
oh no,
no,
it's
not in
not
a
recreational.
recreational way. Microdosing. We're talking about microdosing by a trained professional. Hmm.
And then psilocybin,
Yes,
which
yes,
is
yeah,
psilocybin.
something like
Uh,
that.
yeah, all of that is becoming very, very popular, especially ketamine. And they're advertised for trauma. And
Hmm.
I just want to say, I'm going to put a plug in. Uh, these type of therapies, I'm old. When you get to be old, you see there's nothing new under the sun. These therapies are being marketed as the 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 way to fix trauma for good. You go get a dosage of LSD. It's done by a doctor, or you get some kind of hallucinogen, and it's done by a doctor. It's injected or it's in a pill. It's monitored medically. It's prescribed, and your trauma is gone. Uh, I just want to say, and I'm going to go out on a limb about this. This has been going on since the days way before the days of Prozac. When Prozac came out in the 1980s, early 1980s, it was on the cover of Newsweek, and that green little green little pill, was going to fix depression. Depression would be gone. There would be no more depression. Science had cured depression. It was a miracle pill. It was the magic pill. And look where we are today. We have more depression than ever. Suicide is higher than ever. So, my point being, and then I'll shut up, is be wary of these fads that come along that promise, number one, the magic pill answer, and two, that it's permanent, because we don't know that. And, Carmen, okay, I go take ketamine, and of course I'm going to feel good. It makes people feel good. That's what ketamine does. It makes you feel terrific.
Yeah.
And I love it, and it does wonderful. I'm 35 years old. Am I going to be taking it when I'm 60, when I'm my age? Am I going to be taking it when I'm 69 years old? What's it done to my body? But anyway, I'll get off the pulpit, and that's my brief version of trauma history. But hypnosis, and we can get into it in a bit too, because part of what you want to talk about is false memories.
Hmm.
But hypnosis, hypnosis is one of the tried and very true ways to treat trauma. It's not addictive. You don't have to take a pill, and it will not. Uh, you can take it the rest of your life if you want, or you can do it at home. Okay. Now I'm
That's true.
sure you're sorry you asked that question.
Okay, we know your stance on medicine and on drugs very well, and you are correct that hypnosis has been around forever and ever, and it's been the very first modality to ever address healing and releasing trauma. But even when approaching a hypnotherapist to seek resolve for past trauma, recent or old or past trauma, doesn't matter. We have to make sure that um, the client, the therapist, is equipped to handle what comes after. If there is a catharsis, which catharsis is a healthy healing mechanism, but sometimes a client might interpret catharsis as unpleasant. Well, it's not always pleasant. So um, I've um, I've read a lot of stories about therapists that have gone to treat trauma in clients that they were not prepared to handle the after the session. So I have had excellent success in resolving trauma with my alchemical hypnosis. And I've had a couple of clients that have dealt with trauma in the past and they were hesitant to talk about it again because they've done psychotherapy. And what you do in psychotherapy, you talk. So what happened? How you feel about it? And what happened then and how you feel about it now? And then what happened and how you feel about it? And at some point, you get tired of how you feel about it. Well, I'm angry. It hurts. I want to get rid of it. That's how I feel about it, right? So how many times are you going to keep out, unless you're provided with a list of feelings, which does exist. But anyway, so the the beauty with hypnotherapy is that the client is not going to re-experience the upheaval of the trauma. You might, in my experience, well, the subconscious doesn't communicate in words and numbers. It communicates in images, and it communicates in things we don't necessarily understand. But when I work with trauma on my clients, based on the images, because this turns into a conversational hypnosis, right? Based on the images that they describe, then we do something about it right there. And a lot of the images come up are not related to what happened during the traumatic event. Very little, maybe not even 2%, right? Like, when you have weird dreams and it's like, oh, where did these people come from? And you dream that you're at home, but it's not your home. Similar things like that. So hypnosis is highly successful with a proper hypnotherapist to handle past trauma. But I do want to add that the client has to want to release it, because unfortunately there are people that they're not. There is a psychological gain in being tended to. You have a boo-boo, you have something that hurts, and then people liked unconsciously, they like to be tended to. So that's a psychological gain. And sometimes clients are not ready to release it. Other clients, they identify with it. And when that gets rooted deep into your identity, that's not very easy to release it, because that's who you are. I've been traumatized. Well, I experienced trauma in my life too, but I don't identify with it. You've experienced trauma in your life, Randy, and you don't identify with it. And both of us, having had experienced trauma in our life, maybe that's the reason that we became therapists and we're doing what we're doing today, helping others overcome it. But one of the so it's very important for the client to want to release it. It's very important for the client to not have it so deeply rooted in their identity, because that's something that has happened to them. It's not who they are, right? And trauma, it's a well, feeling traumatized, that's a normal reaction to an abnormal event, right? So understanding that from there we can go further and work on on the effects. Because how often me and you did we talk about that whatever trauma or bad thing that has happened, it lasted for maybe a couple of minutes, and then how many years have passed by, right? So right now, trauma is not ongoing. Well, sometimes it is in the case of domestic abuse, or being in war, or being in environments like this. But another point that I want to make is that PTSD, or high anxiety, or panic attacks, a traumatic event could have happened in the moment, like you're afraid of dying, just by playing as children. Pure play, no ill intention. You fall on your back, somebody falls on your chest, and then you feel like you're dying. That PTSD. That's play. Nobody cries about it. The child has registered that I'm afraid I'm going to die right now. They couldn't breathe, right? And then they go on as adults and end up with anxiety and panic disorders. Or again, you play again, swimming, and then you have someone pushes your head under the water. Of course, there's going to be the reaction of a fear of that, right? That's play. So that was playful, nobody complains about it. Or if the child complains to the parent might say, oh, that was just play, you just get over it, right? And then later on, the adult ends up as having anxiety or panic attacks. So trauma doesn't happen always and only, it's not limited only to negative events. It can happen just by out of play. Or I remember you telling us the story of the little boy that was masturbating while taking a bath, which that's what boys do. I mean, they have something that they're playing with, and they end up masturbating, and then the father comes in and yells at him all over. So that's another. I mean, it leaves an imprint. I mean, in the story of your little boy, um, I don't think there was a case of life and death situation, but being startled so badly, knowing that you're not doing something bad, to be reprimanded for that, that also leaves an imprint. Um,
Well, and I, I would say that kid, that the guy as a kid might have felt it in his life. His father was kind of abusive, and he might have worried that he was going to be hurt seriously or killed.
that's true. That's true. That's true. So emotional trauma. See, with the physical trauma, you can see the physical trauma. So you're taken to a hospital, taken to an emergency room. Something is done about the physical trauma, but emotional trauma, they're not so easy to identify. And then another big point I want to make, that chronic illness, it's an ongoing trauma. So all of this chronic illness, they need to be addressed as well. That people get used to it, and treatment is available, and diet, following a good diet is, of course, it helps with all of this chronic illness and inflammation. It's the biggest culprit, or autoimmune, but inflammation. Old infection that turned into an inflammation would definitely trigger a lot of chronic illness. That needs to be addressed as well, and resolved, because not that the chronic illness is going to go away, but it might get better because you reduce the stress. Everything gets better when you reduce stress, right? But when things are resolved, the way, in the case of a chronic illness, the way the chronic illness is experienced going forward, it's not going to have the same experience. It's just going to be different. And that is a big deal because um, it is the experiences we complain about. Having a pain, having a symptom that causes an experience. So it is the trauma is an experience, a past trauma. It's an experience that has caused a trauma that still lingers in people's subconscious. But what the neuroscientists have found lately, there's so much neuro research going on lately with all of the advancement of technology, the functional MRI. But now the scientists have more well, software to measure, but they have all of these big electrodes cap that they use, like not even close to 100 electrodes, almost like a big head full of electrodes instead of hair. Um, so what the neuroscientists has found is that false memories, they do exist, and people do have false memories often. And of course, this is not intentional. Um, and what the neuroscientists found is that the electrical signal in the hippocampus is a major part of the limbic system in the brain. These electrical signals can differentiate between the imminent recall of authentic versus fabricated memories. Now, this is a big deal to be able to pinpoint this through the science. And what the neuroscientists have found is that when now these findings offer great insights into memory retrieval, but also they provide great therapeutic intervention in the disorder of post-traumatic stress disorder, because it's almost impossible not to have some sort of false memories from experiencing trauma. And if the false memories are positive, I hope most of the false memories are positive, and the psychological trauma is not as deep, although the physical body will register all of that experienced trauma. But what happens in the hippocampus, the electrical signals, they differ immediately prior to recollection between the true and a false memory. And I'm reading from the article. It says, compared to true recalls, the brain exhibits lower theta and high frequency oscillation and higher alpha beta oscillation before false memories. And to me, that makes sense because higher alpha beta oscillation implies arousal, and lower theta, it's a decrease in arousal, and higher alpha and beta is an increase in arousal. So there is so much automatism in the physical body that we can a lot can be identified by the science. And another part of this article says that degree of hippocampal activity can reflect the similarity between correct and false memory, whether the memory is based on source or semantic context. This is significant in neuroscience. But in my experience, based hypnotic retrieval with my alchemical hypnosis, it turns into a conversational hypnosis. And I have noticed the quality of the images that the clients describe for me to assess whether they're manufacturing something or something really shows up, whether the subconscious really whether they trust the subconscious to reveal something, or maybe they manufacture something. It's something quite interesting. Um, so all we can do is encourage the client to make them more comfortable, build a better rapport, increase our equity, and spend more quality time in more retrieval and alchemical hypnosis. And the beautiful aspect in my experience is that my clients, they don't re-experience trauma, and not even recollect the whole events, and that's not needed. Eventually they begin to talk about what really bothered them, usually when they were children, and the values that they had during the time that the trauma happened, as opposed to the values they have nowadays. They are able to reconcile those values. Um, and then when you reconcile those values, forgiveness just happens automatically. It's it's such a beautiful thing to see someone forgiving their perpetrator. And sometimes the perpetrator, it's it's not done with ill intent. It's done through survival. That's how life is. It's not always Trauma is not always the result of ill intent. So it's good to keep that in mind. Anything you want to add, Randy?
Well, I would just say that, yeah, hypnosis is very powerful to deal with trauma and can help. And just like you said, there is never a need to have to go back and go through a traumatic experience to resolve it. EMDR tends to do that. EMDR is kind of a exposure therapy via hypnosis kind of thing. And I'm not knocking EMDR because it's got a real good track record. Uh, but it has its, nothing's perfect, and there are some people that EMDR is very difficult for, and standard hypnosis may be better. So, what does hypnosis do to resolve trauma? Well, a lot of times it simply goes back and helps heal the person that was damaged, however that would be. And that's not any, there's no big mystery to it. It's a matter of just having some, getting eventually, I think you mentioned this, Carmen, getting eventually a perspective on it that's more balanced so that the trauma does not impact a person's ability to have a satisfactory and fulfilling life otherwise. If it's if it's uh, I can give you an example. I was talking to a friend of mine the other day. The movie The Exorcist was just re-released, and boy, did that movie traumatize a lot of people. Whew. And I was just mentioning it because it's a classic movie, not for everybody. And my friend was saying, "Yeah." I said, and I asked my friend. I asked her, "Well, did you ever see The Exorcist?" My father drugged me to go see it, and I was 15. And yeah, I was terrified. Let's see the kind of person he was. You see what kind of man he was. He was that kind of person. Well, there's a part of me as a therapist that thinks you're still dealing with him. You're still having a reaction to him like you were 15 or younger. And hypnosis would help somebody like that have a more balanced view, not to say, "Oh, that was just my dad, ha ha ha."
Mm-mm.
No, it's not to excuse it
Yeah.
or to pretend like it didn't happen or didn't hurt, but it's to say, my father had a sadistic streak in him, and he liked to see us terrified, and he took us to that movie, and I was never the same, and I don't want to see it again. That kind of thing.
Yeah.
So that's how hypnosis helps a person get, get past it and have a life, even though it's still impacted. Because one of the things that I struggle with is learning hypnosis. I mentioned this to you, I think, Carmen, was okay. You go to a hypnotist, and you were traumatized. Your father was abusive and beat the heck out of you, beat the hell out of you, and was alcoholic, and it was miserable, and you still can't function to this day because if somebody gets mad and upset, that brings back that memory, and you're still mad at your father, and you have dreams about him, etc., etc. Part of my thing was, okay, well, you go into hypnosis and you regress back. You can't change history. You can't make that not happen. Well, what's the point? I mean, you can't make the father okay. Or take another more pertinent thing. A young boy who was abused by a Boy Scout leader, horribly abused, or by a football coach like Jerry Sandusky, who was an evil monster, is an evil monster. Horrible, horrible stories of abuse. Well, you go into see hypnosis. Is that going to change that? No, it's not going to make it different, but it's going to help somebody see it in a perspective that makes their life more balanced. You agree with that?
Correct. Yes, we change the perspective, and it's a lot that goes into changing the perspective. We have values, we have beliefs, we have memories, and even now with the new development in the neuroscience, that there could be false memory. Even this plenary information could also help put it in perspective. But what I found in my practice, that it is just so beautiful to be able to forgive that. And forgiving doesn't mean condoning, it doesn't mean allowing someone to keep on doing the same thing, but just stop being angry about it. It just, you can still, you're not gonna like it. Nobody likes trauma. Well, there are some people that they enjoy pain, but that's different because they choose it. That's not something that you're gonna like. It's not something that you're gonna so talk about it happily. Well, happily when you share it to help others, yes. But um, the resentment towards it, the anger towards it, if we get to release that, because that's something you feel in you. What's happened is so long ago, and if you still hold on to it and you feel it in within, it's heavy. So what we do in hypnosis, we help you release a lot of that. And then it's going to take a few couple of sessions, because there is a habit after all of these years, there is a habit of being upset about it, being angry about it, and not liking it, not agreeing with it, disagreeing, this shouldn't be, this is wrong, right? But um, I have a lot of exercises that I give my clients to practice. Everybody gets homework. They don't have time to say, okay, it's just a thought. It's only going to take 2 or 3 or 5 thoughts, and it's not going to take more than 30 seconds. Do this exercises. And then you catch yourself being angry about it, and you remind yourself, like, oh, I resolved it. But the secret is that not repressing emotions, feel the emotion, and it doesn't take more than 60 to top 90 seconds to feel the emotion. Feeling the emotion doesn't mean expressing emotion, doesn't mean throwing your emotion on somebody, but feel the emotion, and then reset. Even when we have memories, acknowledge, kind of like doing a little bit of shadow work, like, yeah, here's my shadow, I'm still angry about it. It's okay. So you acknowledge, you're angry about it, doesn't take more than 15 seconds, move on. Because your subconscious it's very, it likes that. It's grateful to you when you do a little bit of the shadow work, like, oh, you're angry again about it. Oh, just a little bit. So your subconscious is grateful for you to acknowledge that. Because you don't acknowledge, then you keep on pushing, shoving things down in the subconscious. But then there are people that they're so rooted in their identity that they have been traumatized and this is their identity. That's a little harder work if they don't want to. Some of them, they have the perception that someone else has to, because someone else has traumatized them is the therapist that has to fix it. For them, there is nothing for them to do, which is thoughts. There's thoughts. There's certain thoughts I'm going to have you think. There's certain exercises I'm going to have you do, and if you don't do them, then it's not gonna bring you fruits. Um, but I do have a high rate of success, especially with the alchemical hypnosis. It's mind-boggling. Some people recall real events, some people recall some sort of fantasies. They don't even know where is that coming from. It's not something that they've seen or it happened in their life. um, it's just, for me, it's beautiful work, and to just see the client come out and with a smile and say thank you, and do a few hugs, a few spiritual hugs. It's quite something.
You know, the there are many examples. I try and collect these when I see them, but there are many examples of people who were able to give a good example of how to cope with trauma. And I say good, I don't mean that it's the right
Hmm.
way, but it's a way that seems right. And I just share, can I just share an example,
Yeah.
a very famous
Hmm.
example? Uh, there's a Catholic uh, nun, Sister Helen Prejean,
Hmm.
born in my town here in Baton Rouge. Went to the high school that my daughter went to, actually, years before my daughter.
Hmm.
Then became a social worker. Well, she wrote a book called Dead Man Walking, and it was about her uh, giving bringing religion to men on death row at Angola, which is the most notorious prison in the country, probably.
Hmm.
And it's a particular about one particular inmate. I think his name was Sonia, I think,
Hmm.
and he was on death row, and she was his minister. She was his spiritual guide. He was eventually put to death. Well, his crime was the he the one of the people that was the victim of Sonia wrote a book too, and the book was called "Forgiving the Dead Man Walking." Forgiving the Dead Man Walking. Her story was he just picked it. He went to a parking lot or someplace they were her and her boyfriend. She was like 17, and her and her boyfriend were in a car somewhere, and I think it was Sonia. I think that was his name. Anyway, they saw them parked there. He drove up. To make a long story short, he shot and killed her boyfriend in front of her. He raped her and tried to kill her. Now, do you think she was traumatized? So it was after years of help. I don't know how much therapy she got. uh, Eventually she was able to come around. She had a lot. She was very religious. She was very Catholic, very religious, and eventually she was able to come around and as the book title says, to forgive this man for what he did to her and uh, her and her boyfriend, and was able to live a very productive, happy, and I guess happy. I mean, it seemed like a productive, very satisfied life. She got married, had kids, started going to, talking about how to forgive people, how to let things go. And that is a wonderful, I think, example of what hypnosis can do for some people to deal with their trauma. She didn't think he should, she was glad he was executed. She thought he should have been. She didn't forgive him. I mean, she didn't forget him. She didn't. pretend like it didn't happen. Her forgiveness of him was that she forgave the fact, as I remember, it's been a while since I've read that book, but she forgave his inability to be a normal human. And it didn't mean that she accepted it, didn't mean that she was thought he should live. Um, so it was just a very interesting
Yeah.
story, and it was a story that was not told by Sister Helen Prejean. She does not tell that side of it, and that was a big controversy here because uh, Prejean focused on the perpetrator, not the victim. So it was a very inspiring story. There are many, 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 many stories like that out in the real
Yes.
world, and that's what eventually that's what a good hypnotist can do to help somebody adjust to trauma.
Yes. Yeah, definitely. I wholeheartedly agree. Absolutely. So hopefully someone got something out of this. They understand their bad things that happen to them. Not everything is done with ill intention. A lot of things are. Um, but sometimes, see, like someone asked me recently what hypnotherapy is about. With hypnosis doesn't necessarily deal with mental illness or emotional with trauma. Um, Sometimes you have things that have hurt you. Something is sitting heavy on your heart. A loved one abandoned you. You lost something that is just heavy on your heart. That's not mental health. It's just we all have things that are heavy on our hearts. And for some people, sometimes is it's not so easy to, let's use the word let it go, right? Right, but the correct word is, rise above it. So hypnosis helps with that. You don't need you don't need to take it's not something you need to take medicines for, but it's something that could trigger you, could definitely trigger you in some different events. Um, yeah, yeah. So it's definitely good to know, and hopefully we've helped a couple of people understand what trauma is about and what is not, and what is not talked about all that often, and hopefully they can make some decisions that are going to enhance their lives. So let's hope so. Is there anything else you want to add, Randy?
No, I think that sums it up well. I think, yeah, I think the bottom line is that there's no need to suffer. And if you're not sure that it can help, you can always talk to somebody and see what they say. There's in this day and time, this is Mental Health Day. There's no reason to to go through that kind of suffering. There is help available for most people.
Correct. Correct. All right. So thank you. Good night. We'll see you